Hello, warm welcome to MSK Rad Videos. If you're watching this on YouTube, do consider heading over to the website mskradvideos.com, where you can not only watch all the tutorials that are freely available here on YouTube, but also you can look at the cases yourself in a PACS viewer, and it's all free. You don't need to sign up or anything. So this is the second in a series of short tutorials on cervical spine trauma. You may want to watch the first one before you watch this, and also there's a couple before that on the thoracolumbar trauma, which also have relevance to the interpretation of the cervical spine, because essentially the way that the spine fails under force is the same regardless of the location of the injury in the spine. So we'll kick off with the first case. So this is case one if you're going through the cases yourself on the website. And what we're going to look at in this short tutorial is the differences between a hyperextension teardrop and a flexion teardrop, and how can you tell the difference. And of course, it's important to make that distinction on CT because it helps you predict what ligamentous structures are going to be damaged when you come to interpreting the MRI scan. And it makes your interpretation of the MRI scan so much easier if you've already worked out in your own mind what the mechanism of injury is and what the diagnosis is before you go to the MR. Now, as a basic rule, with a hyperextension injury, because that's a ligamentous avulsion, and just as ligamentous avulsions anywhere else in the body, they tend to be very small fragments of bone. Whereas a flexion teardrop, the break in the front of the spine is because the front of the spine is compressed down and it cleaves between two of the vertebrae, breaking off a bit of bone. And that tends to be larger in size. So as a general rule, very small flakes of bone will be because of ligamentous avulsion and therefore a hyperextension injury, whereas large fragments will be a flexion teardrop. Now, the other point is that with hyperextension injury, with a distraction force at the front of the spine, the orientation of the fracture tends to be horizontal. So, and this is a classic hyperextension teardrop avulsion. So it's a tiny flake of bone, it's horizontally orientated, and we've got a massive amount of soft tissue swelling. And that's really all pointing towards a hyperextension injury. We expect the ligamentous structures to be intact. There may well be longitudinal compressive fractures, which I talked about in the series of these tutorials, but the ligamentous structures will be intact. So when we go to look at the MR of this case, what we expect to see, going firstly to the parasagittal stir sequence just adjacent to the facet joints, I don't expect to see a great deal of edema related to the facet joints. I may get some edema related to compressive fractures at the back, but I won't see any marked edema there that I would expect with a flexion injury. And it can be very, very difficult to see the hyperextension avulsion, which is why we always want to have CT and MRI, but here it is, it's this little cleavage plane going in here with slight disruption of the anterior fibers of the disc space. So at the time of the injury, this has opened up. All of this part of the spine here has driven back and caused this cord injury here. So that's a classic hyperextension. So let's now move on to what a flexion teardrop looks like. And this is quite a characteristic appearance of a flexion teardrop. So I've got a much larger fragment of bone here. And the orientation of this fracture is oblique, so it's not horizontal. It's more longitudinally running down here. It's slightly oblique, and it's a large fragment. Now, when you see a flexion teardrop, one of the things that you want to think about is what position was the spine in at the time that injury occurred. And you can see here that this is a very large anterior osteophyte, and there's also a large anterior osteophyte here. So in fact, it wouldn't have taken very much flexion for this to strike off this bit of bone and cleave off this. So we perhaps won't be surprised in this case when we come to look at the MR that in fact all the ligamentous structures at the back are intact, because this is a flexion teardrop without any disruption of the fibers at the back. And again, I can just look at the parasagittal adjacent to the facet joints, no edema. There would be marked edema there if there'd been a distraction force at the back. So a flexion teardrop does not necessarily mean that the ligamentous structures at the back will be disrupted. Now let's move on to case 5. So here, this is case 5, and here we've got a teardrop which is at the front of the spine with the orientation running longitudinally. So this has quite a characteristic appearance of a flexion teardrop injury. Now, unlike the previous one, the position that the spine must have been in for this part of the spine to come down, make contact with this anterior part and cleave it off, you can imagine what position that the spine had to be in, the degree of flexion. And therefore, you have to assume that the ligamentous structures will all be disrupted, because how else could this spine here with quite a large wide disc space and no prominent osteophytes, it would have had to have been in a severe degree of flexion. So we expect here that the ligamentous structures are going to be disrupted in this flexion teardrop. And indeed, when we come to the parasagittal stir, we see the edema around the facet joints. And here we've got the disruption of the ligamentum flavum and the high signal going all the way through. Okay, let's move on to the next case. So the next one is case 6. This is an interesting one because there are 2 teardrops, one at C2, one at C3. Now, this is slightly confusing because the orientation of this looks to be very much longitudinal. So it rather goes against this being a hyperextension injury, but it's a very, very small, tiny flake of bone. And a very small flake of bone points to an avulsion rather than a cleavage with flexion. And of course, you have to remember that the anterior longitudinal ligament is coming up here and attaching along here, and it will often just take a tiny flake off, which may well appear to be longitudinally orientated. So it doesn't necessarily have to be a horizontally orientated one, which is more when the fibers of the annulus of the disc pull the end plate off. So this is quite a characteristic appearance, really, of a hyperextension where the anterior longitudinal ligament has pulled the flake off. Now, how do we explain this teardrop at the level above? Because in some respects, it's a relatively large fragment. The orientation of it is oblique. We would probably be thinking perhaps this is a flexion injury. But of course, we've already got evidence here that this is a hyperextension injury at this level. We've got massive soft tissue swelling, and it would be inconceivable to get 2 flexion injuries at adjacent levels. And think of the position that the spine would have to be in order to cleave both of these off, and particularly when we've got evidence here that this looks quite characteristic of an avulsion of the anterior longitudinal ligament. So these are hyperextension injuries. And when we go to the MR, we see, as expected, that there's no edema at the back, but there's a massive prevertebral hematoma. And again, it's actually quite difficult to see these injuries at the front here on MR, but all the ligamentous structures at the back are intact. So this is a hyperextension injury at 2 levels. Okay, so that's a short run through on the difference between flexion and hyperextension teardrops. If you enjoyed this, please do like and subscribe, and it will give me the incentive to produce more of these videos for you. Thank you very much.